My name is Jeremy Edwards. I'm with GAINSWave, and I'm here with Dr. David Cunningham, GAINSWave provider in Massachusetts. Dr. Cunningham, if you can kindly tell me about yourself, your speciality, your practice.
Sure. So I'm a family physician. I do full spectrum primary care. And about 4 years ago, I started my own primary care practice with one other partner. It's a direct primary care practice, and we practice between Boston and Providence, just south of Boston in eastern Massachusetts. And about 2 years ago, I became aware of GAINSWave as a treatment option through one of my patients who had undergone the procedure and had nothing but good things to say about the experience and about the results. So I looked into it, and the first thing I did was actually speak with you, Jeremy, and back in on Memorial Day weekend in 2018, I came down to do the training with your team, and I've been rolling ever since. So I started offering the services through a separate practice called Infinity Men's Health. My primary care is Infinity Family Care. So I now have practiced within a practice, and it's been nice to be able to have that balance between the full spectrum primary care and then the men's health focused practice.
That's great, thank you. So you've been offering GAINSWave for about 2 years. How many patients do you think you've treated?
I'd have to go back through my records, but approximately 100, probably in the high 90s, low 100s, somewhere in that range over those
That's
2
great.
years.
And do you offer any other services in addition to GAINSWave for improving male sexual wellness?
Yes, so I do the PRP injections, or PRFM actually, so activated PRP injections along with the shockwave treatments. And I recently began offering EMSELA, which is high intensity focused electromagnetic waves.
Got it. What is it about the GAINSWave program that you find most important, most valuable?
The key for me with GAINSWave is that it's effective, it's evidence-based. There's approximately 20 years, maybe 20 plus years of evidence behind the use of shockwave therapy for improving erectile dysfunction. So it's got the evidence behind it. It's safe. We know that, first do no harm. It's non-invasive. I haven't had anybody stop treatment because of any concerns, and it's effective. I have a lot of satisfaction, high satisfaction rate with the procedure and also with the experience. So it's really important to make sure that guys feel comfortable, they feel supported, they feel that they're getting the value for their dollar, because it's obviously not a low cost treatment, but they feel that they're investing properly in their own health for the future.
On the subject of the patients themselves, is there a specific story or specific patient outcome that stands out to you?
I would say that I've had a number of guys who found themselves back in the world of interpersonal relationships after either the loss of a spouse or a difficult breakup of a relationship. And a lot of times the story goes that they hadn't been sexually active in a number of years. They didn't really have the confidence for whatever reason, whether it's age, comorbid medical conditions, even sometimes psychological as a component of it. They really didn't feel that they had the confidence to be part of that relationship or new relationship again. And I always tell guys right off the bat, this is not about the penis. This is not about the physical act of intercourse. This is about their confidence. This is about how they look at themselves when they see themselves in the mirror. This is how their own self-image. And it also has a lot to do with how they feel they can contribute to another relationship. I mean, again, it's not obviously about the sexual act of intercourse, but it's about feeling that they have something to contribute to an intimate relationship, and then they therefore have the confidence to go out and engage in those relationships. So I've had a couple of guys, like I said, who many of them who have been in that transition, and this really gave them the confidence to feel good about themselves and to project that when they're out in the world. And it affects everything. It affects not just sexual relationships, but it affects confidence at work. It affects confidence in the gym, with their families. Just when we feel that we are capable and we are able, that really reflects on all aspects of our lives.
Absolutely right. I mean, there is a domino effect with improved erectile function and things along the lines of improved self-confidence, self-esteem, your
Yes.
ability to please your partner in different levels of capacities.
Absolutely.
On the subject of GAINSWave itself, I mean, GAINSWave, we do a lot of branding. We do a lot of marketing nationwide to raise public awareness and try to generate that consumer demand so providers like you can see a lot of GAINSWave patients. The GAINSWave portal itself has tons of sales material, marketing collateral. How much of that do you use, and how much of that do you think is instrumental in your success?
Sure, I use a fair amount of it. I kind of pick and choose the pieces that I use, and I often put my own branding on those pieces to use, using the GAINSWave name as the lead. And the beautiful thing about the GAINSWave network and the marketing that you guys do is that men come to me well educated about what it is that they are talking about, what it is that we're talking about, and what it is that they are thinking about entering into in terms of a treatment protocol. I've done other marketing. I'm on the radio. I've done some pay-per-click through some other lead generators to see how those worked. And there is nothing that comes close to the quality of qualified leads that I get through GAINSWave. It's night and day. Because I might have somebody who just heard about it on the radio or saw a pay-per-click ad, and they have no idea what it is that I'm actually offering. They just know that they have ED or they're concerned about their function and they want to talk to somebody about it. But they're at step one. When I have somebody who comes to me through GAINSWave, they're at step 6 or 7 or 8 down the line. They've thought about it. They've gone to the website. They've educated themselves through your material. And they come to me, understanding that this is a premier service, that this is something that is an investment in their own health. And they're far away the best lead candidates in terms of going forward and initiating the treatment protocols. So,
keeping count of the lead. Thank you. Are you keeping count of the leads or the patient referrals that your directory listing on gainswave.com is delivering?
Yes, I mean, I don't have it in front of me, but I do keep a tally as far as percentage of those that are converted into customers or clients versus some of the other lead generators that I've used. So, and it's much higher.
How many patients a month do you think your directory listing is delivering you?
It's pretty variable, but I will tell you that the most astounding thing is that when I went into this 2 years ago, I thought, I did all the calculations, the return on investment calculations, and I figured I would get maybe 3 or 4 a month, and that, at that level, I'd be breaking even for the first year, and I'd be happy enough with that I can move forward. I was getting 3 or 4 a week. So right off the bat, it's been fantastic. I find that it ebbs and flows. It depends sometimes on the time of year. As you and I were talking earlier, this current situation with the COVID-19 pandemic has really seen an uptick in interest in men's health and regenerative medicine treatments. Guys are really interested in improving their health to the best of their ability. And they're sitting around thinking about it a lot more, and they have time on their hands. They're researching it, and they're finding GAINSWave, and then they're finding Infinity Men's Health, and I'm very, very pleased about that. So it is fairly variable. I will say I probably have gotten somewhere between 12 and 20 leads per month through the GAINSWave portal, and that's a really nice number to work with, because then obviously some of them are not going to be ready at this point to jump in, but at least we can start the conversation and get the ball rolling, even if it's down the line.
That's great. And what would you tell a provider, a fellow doctor who's considering adding GAINSWave to their practice?
I would say no hesitation. If you are interested in offering something that A, is effective, B, is safe, and C, is a huge value to your male population in the surrounding area as well as your current practice, there's no question. This is fantastic. It's easy to perform the procedures. The nice thing is that I do the procedures all myself, so I have a lot of time with these guys. So typically somewhere in 6 to 8 treatments, sometimes even 10 or 12 treatments. And you really get to know people in a way that is different than the typical doctor-patient relationship. There's a tremendous vulnerability when guys come in and want to talk about this. And especially, obviously during the treatment protocols themselves, there's a physical vulnerability there that if you respect, they really tend to connect very, very well. So I've had patients who've come back to me after, months and years later, just to touch base and to come back in for some maintenance treatments. You're always generating those long-term relationships. But to answer your initial question, no hesitation. I think it's fantastic. I think you're in great hands with the GAINSWave team in terms of the education, the training, the marketing. It's as turnkey as can be in terms of getting started with men's health and regenerative medicine.
Dr. Cunningham, thank you very much.
Oh, my pleasure, Jeremy. Thank you.